Hi, I'm Catherine Martin from the Faculty of Nursing at the University of Alberta, and today we're going to do the urinary catheterization procedure. We're going to gather our supplies. We'll require a urinary catheterization tray. We'll add sterile gloves, an extra light source, and 2 catheters. In this case today we're going to talk about Foley catheters. Inside our sterile catheterization tray we have a drainage container, we have providing swabs for cleansing, we have lubricant, we have a sterile towel for extending the clean area, and we have a fenestrated drape for putting over the patient. And we have some normal saline solution for inflating the ball in the Foley catheter. And lastly, a garbage. You're going to need a urinary drainage bag, and there's 2 choices that you have. The first choice is a bag that collects urine over the course of an entire shift. And the thing to remember about these is these come with a plastic cap at the end of the tube that connects to the Foley catheter, and you'll remove that cap first. And then you want to ensure that on the bottom of the drainage bag it's clamped tight before connecting it to the patient. It is important when draining this bag that you keep this end sterile and ensure it's not touching the floor or gets contaminated. The next type of drainage bag is called a urimeter, and this bag is used when you want to measure urine output on an hourly basis. Again, it has a cap on the end of the tubing and the part that connects to the Foley catheter, and the urine drains into this plastic container. You can measure it, and then each hour it's tilted back into the bag and you start fresh. This bag also has the same kind of clamp closure that you need to keep sterile and ensure is closed at the bottom. Okay, you want to hang your urinary drainage bag at the side of the bed. Ensuring that it's not connected to a railing that goes up and down, but it is lower than the level of the patient's bladder. Then just bring your tubing up, coil it on the bed, and connect it to the sheet. It can sit there until you're ready to connect it to the Foley catheter. We're going to talk about preparing the female patient for a catheterization procedure. It's important to ensure that the patient's comfortable and covered and respected as much as possible throughout the procedure. Use your blankets to cover both legs, exposing the perineum only. If possible, have a second person to support the patient's legs and offer them comfort throughout the procedure. Now we're going to add the Foley catheter to the tray before we prepare the patient for the procedure. Again, remember that the Foley catheter comes in a sterile package, and you just put your fingers on the part of the package that is not sealed. One of the ways to add to your tray is to just peel it back, hold it on, and very gently add it to your tray. Step back, fold and discard. Now I want to put on my sterile gloves. Remember to keep your thumb back once you put your hand inside your glove, and only touch the inside of your paper. The next thing I want to do is add my drape to extend the clean area for the patient. Just want to take and put the plastic side down toward the bed. The next thing I want to add to the patient is the fenestrated drape. Again, it has a plastic side that will go against the patient, and we suggest that you fold the corners back like that, carry it over, and then just lay it down on the patient. The next step is to start to prepare for your Foley catheterization. I want to open my providing swabs that I'm going to use for cleansing the urinary meatus, and I'm going to leave them inside my drainage container. The next thing I want to open is my lubricant. And there's two ways of lubricating your Foley catheter. You can squirt a little bit at the bottom of your drainage container and then just insert the Foley catheter into that to lubricate it. Or some people like to put it right directly inside of the lubricating jelly in the package. Either way is fine. I also have a syringe filled with saline, and this is used to inflate our catheter balloon. And finally, I want to put my Foley catheter into my drainage container. And again, these catheters come in a plasticized package that is perforated. And all I want to do is roll it up carefully so that it's not floating around. Put it inside of my drainage container and take the end and lubricate it. So it's fairly generously lubricated to ease insertion. After that, I want to move my drainage container over in front of my patient's perineum for easier insertion. I'm now going to clean the patient's perineum. I'll use my non-dominant hand to open the perineal folds. Now that this hand is touching the patient, it is considered contaminated and it needs to remain intact. My first wipe is down the far labial fold, top to bottom. One wipe and discard. My next wipe is down the near labial fold. One wipe and discard. My final wipe is down the center, cleaning the urinary meatus. The next thing I want to do is hold my catheter, and this is where you can use a buddy nurse or an extra light source if you require it. And I want to insert the Foley catheter into the urinary meatus. So again, I'm going to gently insert, sliding it into the bladder, and I'm going to keep pushing it in until I get urine return. Once urine starts to drain through the Foley catheter, my left non-dominant hand in this case can secure the catheter and hold it, and then I'm going to attach the syringe and I'm going to inflate the balloon, either 5 mils, 10 mils, or 30 mils, depending on what's noted on the end of your catheter. Urine will continue draining, and I'll slowly pull the catheter back until it stops. Once the urine flow has decreased or stopped, I will connect it to the end of the drainage tube. The final step is to provide pericare for the patient and cleanup. If your patient has difficulty lying on her back or holding her legs bent up, you can always use a side lying position for your patient and insert the catheter while your patient is lying on their side with one leg bent up. Once the Foley catheter is inserted, you want to secure it to the leg, either with a stat-lock device or whatever your hospital is using. When you're inserting your Foley catheter, if you find you've gone into the vagina rather than the urinary meatus, you could just leave that catheter in there, and then if you have a buddy helping you, they could open a second catheter for you, and you could insert it into the urinary meatus at that time. And that completes the process for female catheterization. Now, let's look at the procedure for a male catheterization. Okay. The positioning for a male catheterization is just to have the patient lie comfortably on his back. Take your non-dominant hand and hold the penis perpendicular to the patient's body. And again, we're going to start with our cleaning procedure using our providing wipes. Once again, around the urinary meatus, you clean one wipe, one way, and discard. And then a second time further out along the glands, one wipe, one way, and discard. And you can use a third one if you need to. If the patient has not been circumcised, you can retract the foreskin. Then you want to take your Foley catheter and again gently insert into the meatus. If you meet resistance and your patient has an enlarged prostate, you may have to gently maneuver around. If you meet too much resistance, do not force it and just get some assistance. Other than that, you insert your catheter until urine starts to drain out into the container. You can relax the penis down at that point. Once the urine finishes draining, you can inflate the balloon, and the amount you inflate it is written on the catheter. Again, inflate it, and then very gently pull back until the balloon is at the mouth of the bladder. You can just remove the cap and attach it to your drainage bag. At this point, you're going to measure the amount of urine that has drained and clean your patient with good peri-care, leaving them support. As with the female catheterization, once the catheter is inserted, it could be attached to the leg with a stat-lock device or whatever your hospital is using. At the end of the procedure, be sure you provide your patient with good peri-care and leave them comfortable and warm and safe in bed. You want to document the time the Foley catheter was inserted and the amount and color of the urine drainage. You want to note if your catheter was a 14 French, which is generally used for women, or a 16 to 18 French for men. And that's the end of our urinary catheterization insertion procedure.